Good evening, everyone. Welcome to this evening's webinar hosted by Brisbane North PHN. My name is Allison Leach, and I'm part of the primary care team at Brisbane North PHN. Here at Brisbane North PHN, we have been partnering with the Queensland Health Cancer Screening Unit, who are sponsoring a project to increase awareness of cervical screening self-collection and provide training to effectively implement it into practice workflows. So tonight's webinar will highlight cervical screening self-collection. And this information is very timely as Cervical Cancer Awareness Week runs from the 13th till the 19th of November this year, and is an excellent opportunity to share important messages about cervical cancer prevention with patient populations. And patients may come into your practice and ask questions about their options. So this is an excellent opportunity to learn more about cervical self-collection and perhaps hone your skills and develop practice protocols to offer more cervical screening opportunistically to encourage screening in those never and under-screened populations within your practices. Before we begin this evening, I would just like to do an acknowledgement to country. We acknowledge the traditional custodians of this land. We acknowledge the waterways, the land, and the sky, and all who inhabit this place and country. We acknowledge their ancestors and elders and recognize those who continue to protect and promote Aboriginal and Torres Strait Islander cultures. We acknowledge the past and stand together for our future. And just a few housekeeping items before we get into the content tonight. If you could please, if you've got any questions throughout the webinar, we're going to hold questions off to the end. But if you could please put them in the Q&A function at the bottom of your Zoom screen, and we will get to them at the end. So any questions you have, please just put them in there. This education session will last for approximately an hour. And as I mentioned, there'll be time for questions in there. And for those who are unable to attend, a recording will be made and distributed for tonight's session. And once the session has ended, an evaluation will appear. We would really appreciate if you would take the time to provide us some feedback, because we do create these sessions for you and we want them to be as meaningful and as good of use of your time as possible. So your feedback really helps with that. So if you could take a moment to do that, that would be fantastic. We are lucky enough to have two speakers with us tonight. So we've got Jenny Harsager, who is the Senior Project Officer for the Cancer Screening Unit of Queensland Health. And we are also lucky enough to have Dr. Meg Cairns, who is a GP at Ashgrove Family Practice. She is a GP Liaison Officer at Metro North Health and here at Brisbane North PHN. And as mentioned previously, I am Allison Leach. I'm the lead of quality improvement and reform here at Brisbane North PHN. Just to preview our agenda for this evening, after we finish the introduction here, Jenny is going to begin by speaking about eligibility for cervical screening self-collection, who is likely to be under and never screened, what are some of the research findings? So what are some of the barriers or reasons why people aren't getting cervical screening done? And where are some of the knowledge gaps, particularly among providers in doing cervical screening self-collection? She's going to talk about NSCR integration and how to get started with self-collection. And then Dr. Meg Cairns is going to speak about self-collection from a GP perspective. So some of the benefits and barriers to implementing cervical screening self-collection in practice, and using some of her own personal experience. And also she's going to discuss some of the resources and conversation starters to really opportunistically mention cervical screening to patient populations. And also, we're going to finish off with some ways you can gain support and further resources about cervical screening self-collection. And then we'll get to questions. So first off, we're just going to pass it over to Jenny Harsiger.
Hi, thanks, Allison. Just a housekeeping note. First, it looks like we may have a question from Dr. Lisa Kurian at the moment. Or is it an accidental hand raise?
Lisa, perhaps if you could, if possible, are you able to put your question in the Q&A so that we can see it? Jenny, perhaps if you want to just begin, and I'll see if I can find out what her question is, and we'll go from there.
That sounds good. I'll go ahead and get started. So thank you for that introduction, Allison. And again, my name is Jenny, and I'm going to talk to you a little bit from a cancer screening perspective about why self-collection, why now, and why we're so excited about it as a way to give women more control over their cancer screening experience and hopefully bring more women to the cancer screening table. So previously, you'd probably be aware that eligibility criteria for a self-collection was quite limited. And that's moving on from 2017 changes, where we went from a pap smear test that looked for abnormal cells, and then we looked to see if HPV was present, and then we looked to see if there were further problems. Once the evidence became clear that HPV was related to most cervical cancers, and by that, I would say that from the evidence that I've read, best estimates are that between 3 and 10% of cervical cancers are not HPV related, although most experts would tend to go on the lower end there at the 3%. And that most of those cancers that are not HPV related are actually quite aggressive glandular cell cancers that are not helped by screening. So we can feel quite confident that HPV screening and an HPV test, as now happens after 2017, is a safe way to conduct the program. So we did know that there were a large number of women, and depending on where you get your data from, it'll be around 65% of women in Australia are participating in the cervical screening program, but that 35% are not. So before June 30th of 2022, once there was a self-collection method that had been validated, that was released in 2019 as an option for asymptomatic women who were over 30 years old and had never screened or underscreened. So that was available, but we saw that there was very little uptake of it at that time, and that less than 1% of the total cervical screens were being done via self-collect. And it had really been advertised as something to do as a last-ditch effort if you're not able to get a woman into screening at all. Next slide. And now we see this shift from July 1st of last year that we want to have more women have access to self-collection, that the evidence has grown. We see that a self-collected sample is just as accurate as a clinician-collected sample for finding HPV. And that's important. We will continue to hit that home through this webinar this evening, that in this effort, we're looking for HPV. We're not looking for other signs or symptoms of problems. And that's why it's very important that this method be left for women who are asymptomatic. The age range has now gone down to those first screeners so that we have ages 25 to 74 eligible. And again, all women and people with a cervix are eligible now. It's very important that we get this message to practitioners at this time because there hasn't been a public campaign towards screeners, but there will be either later this year or in early 2024 that is going to let women know that this is available for them and they just need to ask their GP. Next slide. So again, what we want to do with self-collection is not necessarily to change a woman from one method of screening, a clinician-collected sample, to another method of screening, self-collect, although we do want women to have that choice. But what we'd most like to do is to get women who are underscreened and sometimes never screened into the program. So here's what we know about those groups. They both tend to be the younger age cohort and the older age cohort. The older age cohort in particular, those 70, 74-year-old women participate at a less than 30% rate. So they're really not engaging with the program. We know that people who are Aboriginal and Torres Strait Islander, culturally and linguistically diverse, or at disadvantage, or have undergone female genital mutilation or cutting within a different country, those folks are much less likely to engage in cervical screening. Now, our data around Aboriginal and Torres Strait Islander participation is not perfect because data collection on people who identify is not perfect. However, we do estimate that Aboriginal and Torres Strait Islander people participate at a lower rate, but also have worse cancer outcomes than the general population. Also, lesbian, gay, bisexual, transgender, intersex, and queer communities have lower participation that we know of. That's not something that is, of course, taken on a form that we can get great data on. But in surveys of folks within these communities, they say that they don't participate. Some of it may be due to perception of risk is less, but also we know within particularly transgender communities, they may not feel comfortable accessing a practitioner to have a screen for, let's say that you still have a cervix. So other folks, people with addictions, people who are homeless, people who are in custody are also within those groups. We know that people with disabilities are less likely to access screening, sometimes due to risk perception, but also sometimes due to the structural barriers of having an examination when you have a disability. People with either who are overweight or who are underweight, we've also heard them reported that they don't feel comfortable with the exam. And then I think that there's a very important part here is to talk about previous negative experience with pap smears or with speculum examination. And we across the board heard from women that they were uncomfortable with the examination, sometimes to the point of having pain. And also sometimes because they had been previously sexual assaulted, sometimes even by a medical practitioner, that they were reluctant to participate. One last point is people who are living in remote areas also are less likely to participate, and that may be due to access to a practitioner. Next slide. So at Queensland Health, we have done some research with under and never screeners to try to give us a better idea about women's experience of screening, their knowledge gaps, and also the role of GPs and how GPs can enable participation into the program. So what we heard from women across the board, they didn't understand the program, didn't understand what it was testing for, didn't understand if they needed to have symptoms to be testing, or they hadn't had a sexual partner in 10 years and so weren't testing. A wide variety of reasons for not participating, not understanding the difference between a pap smear and a cervical screening test. Also, that experience or impression of screening I just talked about, some people just find it to be a very, very confronting experience. And then the role of GPs we found even more interesting, because women both said, I don't want to see a GP that I have a really great relationship with for a speculum exam, but I also don't want to see a GP that I don't have a good relationship with for a speculum exam. So there was really no winning there. Either if you're too familiar with your GP or not familiar at all, there were barriers there. So what did we find was, the outcomes here? How can we make this better? They wanted to know more. They wanted more reminders, better normalization of the program, communicate its efficacy. And then we kept hearing about self-collection, although mostly through an at-home collection option, which is not really the intention of the current program. Women at that time did not know about self-collection, had never heard of self-collection. This was in 2020. So I think that it's very interesting that at that time they were bringing it up and said across the board, yes, they participate with self-collect. Next slide. So we'll talk a little bit about what self-collection is and what it isn't, and why we can feel comfortable that this is an acceptable method of collecting. So a self-collected sample, this is important to speak to women about, is taken from the vagina, not the cervix. So that really helps with women's confidence and being able to do the collection, and is tested then for the presence of cervical HPV. As I said earlier, a recent meta-analysis found that using a self-collected vaginal sample is as accurate as a clinician collected sample from the cervix. What you're missing there, and I know Meg will talk to this a little bit more, is that visual exam if a woman's having symptoms of something else. But we know that this is particularly great for finding HPV. Just because we had a question about this earlier, I might just say that the collections that we're seeing are done well. We have less than 2% of the total specimens that are coming back with, and I won't say no result, I'd say an invalid result. A no result means that there's no samples present whatsoever, and you would know that. So that's not going to read as negative. So be assured that when you have somebody doing this collection, you will know whether or not they have those high-risk types of HPV. Next slide. So I'm going to talk a little bit also just about the ways that you can integrate doing self-collection into your practice and reaching those under and never screened women. And one of those is through integration with the National Cancer Screening Register. Now, most of the people I'll be talking to today, I believe will be able to do this because it's available for medical director, best practice, and Communicare, which are the softwares that most folks are using. There's a healthcare provider portal also if you're not able to access the NCSR, but it's so great to just have those results right there. And this next slide will show you what that looks like. So there's first an icon that you would see on your screen that then you can click into, and next slide. Then you would be able to do a participant search within this program that will give you, you can look by Medicare number, family name, given name, because we know for women, sometimes those change. And I do hear providers say, oh, well, I've already got their medical record because they're in my system. But sometimes a woman goes somewhere else for a cervical screen rather than staying with your practice. So it really is important to look within the NCSR to see what their last screen is, whether or not it was abnormal, because that's also going to affect whether or not you decide to offer self-collection. Next screen. So how to get started with self-collection. First, you're going to need to decide how this works within your clinic flow. It is a little bit different than what you're used to. So if, first of all, if you're a male practitioner and you haven't been really that involved in cervical screening, now's your chance, because opportunistically, you can offer a self-collection. You can say, oh, hey, I see while you're in here today that you're due for your cervical screen. Can I have you talk to the practice nurse who will give you your self-collection kit? It's really just that simple. And, that's another thing to talk about with your flow, the role of the practice nurse. How can you use this time to talk to a woman maybe about other risks? Use those options that you have within the National Cancer Screening Register and your own systems to look for under and never screened women. Ahead of time, order a bunch of self-collection kits. You can get those through Foresight, QML, SNP, and VCS, which is a large cytology service in Victoria that does a lot of self-collected cervical screening. Just a reminder that's important to always label these as a self-collected sample because they are tested differently. And I've got a little bit of information here about additional information that's available, education modules and pathways, which I think will be spoken to later. Again, we just want to encourage you that this is going to become a normal way of doing practice, and you can get at the forefront and really make this work for your patients and your practice. And next slide. These are just the references that I've used and some of the points that I've spoken to. And if you want a copy of those, please just ask the PHN. Thank you.
Thanks very much, Jenny. I'm Meg Cairns. I'm a GP in Ashgrove, and I have been having patients do cervical screening self-collection since it was introduced last year, and I thought I'd share some of my experience with that. Next slide, please. So I thought I'd cover what are the benefits for patients and for GPs, and a lot of this has been covered already by Jenny. I'm going to talk a little bit about barriers. I'm going to talk about my experience and show you some resources of how things you can use in your practice, and some training that you can do if you need some more information. Next slide, please. So what are the benefits for doing self-collection? So as Jenny mentioned, it increases awareness of cervical screening with women, and that we can, if they haven't been having screening or they've been under-screened, if we can talk to them about self-collection, it may increase their participation. And so it's just another opportunity for us to talk about various types of health screening that are important to participate in, and being able to offer a different option might encourage women to participate. So it's particularly beneficial in women who are never screened and those who are under-screened. And the other good thing about it is you can offer it opportunistically. So it's the sort of thing you can talk about even right at the end of a consultation. It doesn't take very much time to check if somebody is due, and you can say, well, how about you consider doing this today? And you show them how to do it, and that they can do the collection, and then their cervical screening is up to date. Next slide, please. So what are the barriers? Jenny talked a little bit about this. So some of the barriers are patient barriers, and some of them are health system and health provider barriers. So one of the things, some health providers have raised concern about missing the opportunity to do a visual inspection of the, vulva or vagina or cervix. But the way I think about that is to really keep in mind the difference between screening tests and investigations. And as part of the history taking that you do when you're talking to someone about cervical screening, if the patient declares any symptoms whatsoever, then the self-collection cervical screening is not necessarily the right test for them, and that they should be having a physical examination and then an investigation of their symptoms. So if someone is completely asymptomatic and they're purely presenting for cervical screening, then you can confidently offer the self-collection. Patients may share some of those same concerns. You know, they may worry about, well, you're not having a look at things. Is that okay? And I think with the information Jenny's provided tonight, that, you know, we can reassure patients that it's an accurate way of doing human papillomavirus testing in women who are asymptomatic. What are some of the other barriers we might come across? So patients might not really feel confident to do the test. You know, they wonder about, you know, how do you actually do it? So I'm going to go through some of that shortly and explain how easy it is. Some of the, you know, some doctors may not feel confident to offer this because they may not feel they've had adequate training, or they may not feel comfortable discussing reproductive and sexual health. And that's where you can look into, you know, do you need any additional training yourself? Can you use some of the, you know, visual aids that help you explain this to patients? Could you engage the help of your nurses or to chaperone you during a discussion, and, you know, maybe even assisting the woman explaining things further when they go to do their self-collection? So I'm going to show you some resources about that shortly. So next slide, please. So there are lots of resources for GPs and for patients to learn about self-collection. So this is just one of them. This is the cervical screening communication toolkit from the National Cervical Screening Program, and it's got some useful tips about how to discuss this. It's, you know, there's fact sheets for patients, there's further information for clinicians as well. Next slide, please. Under the, you know, the Commonwealth Department of Health and Aged Care website, they do have lots of information about the cervical screening program and how you can talk about self-collection, how you can engage patients to participate, and how you can, you know, demonstrate that you're, you know, demonstrate respect and how to build trust with patients. So you might want to have a look at some of those tips if you felt a little bit uncomfortable about doing this. It explains some of the reasons why you might feel uncomfortable, why patients might feel uncomfortable, and helps you work out some ways to get past that. Next slide, please. And this is just more information about what I've been talking about, which are what are the barriers to screening. Next slide, please. So I'm just going to talk a little bit about my personal experience. So how do I do this in my practice? So I use best practice, and I keep the recall and reminder box up to date. So, you know, whenever someone's had their cervical screening and, you know, there's a recommendation made for it to be repeated in 5 years, I make sure I record that in the reminder section. So when patients come in, it's my usual practice to check that reminder section every time. You know, it's part of my conversation I have with them. I say, oh, let's have a look at what health screening things are due, or, you know, what things are you due for? If it is due, if the cervical screening's due, then I mention it at every appointment, reminding people at every appointment until we get it ticked off. And I particularly talk about it when patients have come in for contraceptive advice or a contraception prescription, or if they're coming in to talk about sexual and reproductive health, if they're coming in for their breast cancer screening. So I'm in any of those sorts of consultations, I check if they're up to date for cervical screening, and if they're not, we have a conversation about getting it up to date. I do like the fact that best practice and medical director are integrated now with the National Cervical Cancer Screening Register, and so I check patient's history and I check their eligibility. And for all eligible patients, I offer them the choice of self-collection or clinician collection. If a woman's choosing the self-collection, it's important to just inform them that if they do have any HPV detected on that self-collection, that they will need to return for a speculum examination for liquid-based cytology if the HPV not 16-18 is detected. And if the HPV 16 and or 18 is detected, they need referral to gynecologist for colposcopy. I'm just going to get you to go to the next slide, please. And the next one, thank you. The next slide, please, thank you. So this, I keep this handy. Oh, sorry, go back to the flow chart. Thank you. Yeah, I keep this slide, this poster on a notice board behind my computer. So this is the cervical screening pathway. And just to, you know, be reminding yourself when you're checking someone's history, you know, what do I do next? You know, are they eligible for self-collection? Do we need to do clinician collect? Do we need to be doing co-test? You know, so I just keep this handy at all times. It's very useful. Once you've determined that someone's eligible and you've explained what might happen if any HPV is detected, you know, you then support the patient's choice. You know, if they choose self-collection, we go ahead and do that. And if they choose clinician collection, then we go ahead and do that. So I'm just going to go to the previous slide. Thank you. So when I'm getting patients to do self-collection, I routinely use visual aids to explain how to do it. And this is the particular one that I use. As Jenny has explained, so I keep enough kits in my consulting room at all times from all the pathology providers. So they all provide kits that include the specimen bag, the instructions, the swab, and the thin prep jar if you're using the providers that require you to use that, and also space in the bag for the pathology form. So I then you know, complete the form, and Jenny, I think, has gone through this, where you have to indicate the test you're requesting. You have to say which site it is from. So you need to say whether you are doing a cervical test or a vaginal test. And then you have to indicate whether it's self-collection or clinician collection. And then you put any relevant clinical information in there, such as their period dates, etc. And then I, you know, show women this particular diagram, and I usually get them to go off to the toilet to do their collection. And I, you know, just go through this step by step before I send them down to the toilet. I get the patients signing the pathology form before I send them off. I love the fact that they are often pre-printed with identification stickers. So I put that on the swab and on the thin prep vial when you're needing to use that. And then I give it all to the patient and send them off to the practice toilet. Now, you may have heard Jenny refer to the fact that it's preferred that the self-collection happens in your practice, but the National Cervical Screening Program has said that the collection can occur in another setting that the health professional considers appropriate. So it may be considered appropriate for doing telehealth and for women to collect the specimen at home, or if they've seen you in person, to take the swab kit home with them. However, they do need to return it back to the GP to then, you know, take the next step and send the specimen off to pathology. So it's not intended that patients drop these off to pathology branches. They need to bring it back to their GP. Now, some patients might not feel confident to do this on their own, but they still would prefer a vaginal sample be taken. So that it's quite okay for you to do the vaginal swab. But if you are doing that, you still mark it on the pathology request form as a self-collection. But it's perfectly fine for a patient who needs some assistance if they ask you to take the swab for them. And in general, I guess in summary, I'd like to say there has been very high acceptance of this when you start talking about it with patients, and some of them will in fact come along specifically asking for it. And it's particularly a high acceptance in never screened women, under-screened women, and patients who identify as LGBTIQA+. Now, and we still need to consider, though, that some patients do prefer a clinician-collected cervical sample. So I think while on one hand we want to offer the option of self-collection, we need to present all the possible options to patients and let them choose what they feel is best for them, and then support them in that decision. Next slide, please. Next one. Yep, now I'm just going to show you some resources. So sorry, go back to... Yep, so this is Brisbane North Health Pathways, and the username for this is Brisbane. The password is North, so capital B for Brisbane, capital N for North, and we're going to show you the link to this later on. Brisbane North Health Pathways is like a giant textbook on almost every topic you can think of, and there's one here on cervical cancer screening that's been localised for Brisbane North. So these are kept absolutely up to date, and you can go through this and check that you understand all that you need to know about cervical cancer screening. So next slide, please. When you get to the bottom of the health pathway on cervical cancer screening, there's some very useful information for health professionals and for patients. So I'll just show you that there. And next slide, please. Now, at the bottom of that previous slide, you'll see there were options for health professionals to get more training. So additional training in cervical screening is free of charge, and there are a number of providers, so it's all free of charge. So this is one provider called GPX, and I'm just going to go to the next slide. This one is through the National Cervical Screening Program. So that's another type of training you can do. And next slide, please. And then you can also do training through True Relationships and Reproductive Health. And as I said, they're all of those providers, they're online training, they're free of charge, there's professional development hours associated with it, and it will get you completely ready to be confident to do cervical screening, self-collect and clinician collect. Next slide, please. And yes, that's the end of my presentation, and I very much welcome any questions. Thank you.
Thank you very much, Jenny, first off, for sharing your knowledge and insights, and Meg for sharing your personal experience with implementing cervical screening self-collection in practice. I just wanted to take the opportunity to introduce you to the Quality Improvement and Development team at Brisbane North PHN. So the engagement team regularly attend practices and receive phone calls to provide advice and resources and project opportunities to drive continuous quality improvement activities in general practice. And at Brisbane North PHN, we are currently running a cervical self-collection project funded by the Queensland Health Cancer Screening Unit. And to those that are part of the project and attending this evening, you may be familiar with some of these faces of the engagement team, as they have likely been in contact with you to discuss the project and coach you through the first steps. We have 11 practices who have been selected to participate. And to those who missed out on the opportunity but would still like more assistance with implementing self-collection in your practices, I'll show you how you can access some of the resources to support you. Next slide, please. So this is a resource pack that we've developed, and this has got a lot of the tools that Meg has already mentioned in it. Next slide, please. So some of the things that are available there will allow you to fulfill some of your continuing education CBD points particularly the ones for reviewing performance and measuring outcomes, which tend to be some of the trickiest points for GPs to fulfill. And these are a couple resources that can help with that measuring outcomes. And so there's two ways in your practice that you can keep track of your offers for cervical screening and what the end result of that offer was. So the resource on the left part of your screen is the procedures for basically keeping track of your offers using, we've got resources for both best practice and medical directors. So that will allow you to simply cut and paste into your practice software. And you can simply check when you've done an offer and what the result was. And then you can track that at the end of the week or the end of the month and see what the results have been. On the other side of your screen, you'll see a manual offer tracker where you can basically keep that piece of paper in your office and keep track of the offers and the results. So those are just a couple resources that make measuring outcomes easier. Another thing that is available in the resource pack, next slide, please, is this task planner. So this is a Plan, Do, Study, Act master planner. And basically what it's got in it is a whole list of lots of different activities that you can do in your practices to help implement cervical screening self-collection. So you can simply check the tasks that are relevant to your practice and do those. So for example, one of them on there is linked to the NCSR if you haven't already. And right beside that is a handy link where you can just click on to find out how to do that. Another thing is basically placing some of the posters in your practice to advertise cervical screening. And there's some handy links there to where to access some posters for your practice. There's handy links for putting how-to guides that you can put in your practice toilets so that patients have handy references there. And there's also links to a lot of the resources that Meg spoke about that she uses in her practice. So they're all right there and ready to use in an easy resource. Next slide, please. So this is just the second part of the resource. Again, it's got some of those links to those free educational webinars if you'd like more information. And again, they are available on demand and free to get more information on cervical screening. And just the rest of other steps that you can take in your practice to implement cervical screening self-collection. Next slide, please. Some other things that are also available as well on the health pathways is there's how-to videos. So you can put videos up in your practice showing how to self-collect for your patients. There's also posters as well. Next slide, please. And I think it's important to note these how-to guides and posters are all available in different languages, making them handy to use in all practices. Next slide, please. So this is another resource that is available, this cervical screening guide to understanding your test results. So this is another resource that you can give to your patients so they can understand a little bit more of the test results. And then beside that is an example of the how to collect a sample. So that resource is one of the resources that is available in multiple languages. Next slide, please. So what are some of the next steps that you can do in your practice? You can think about organizing self-collection training through a team meeting. So taking a whole team approach. So as Meg alluded to, having an approach where you have a practice nurse involved can really help with clinic workflows. Arrange self-collection kits with an accredited provider and understand the processes. So there are differences in kits provided by different providers. So it's important that you know what the process is for the particular pathology provider that you use the most. know your practice's data, such as how many patients are eligible. And also, since you're doing these activities, record any QI activities for accreditation or CBD proof. And these are all things that we can certainly help you with. And as we come to the end of this webinar, I'm just going to remind you to please, if you would, complete the evaluation that comes up at the end. We're going to move to the next slide, please. And I provided a couple of links, and they are the links for pretty much all the resources that we've presented throughout this webinar tonight. So the first one is for the health pathways, which Meg spoke a lot about, the resources that she uses. And that's the top one is the website for that. So screenshot this if you would like, otherwise this presentation will be sent around. And the bottom one is the email. That's the email for practice support. So if you would like to get the resource pack that I was talking about to use to support your CBD points and just some of the activities that you can do, you're welcome to email practice support, and we can make arrangements to send that through to you. I'd just like to remind everyone that if you've got any questions, please put them through to the Q&A, and we'll move to questions now. All right, so first question, Jenny, perhaps this is a good one for you. Can you please speak about some of the differences between the differing test kits?
Sure.
From the different pathology providers.
Yeah, I'd be happy to. So at the moment, there are two ways of not collecting a self-collection cervical screen. That's going to be the same no matter what pathology provider you go with. However, what you have to do on a clinician end can be different. So there are what we call just a dry method, which is using the dry flock swab that gets packaged up, sent away. And then there's another method which that dry swab is then swirled in a thin prep vial. And it really just depends on which pathology provider you're using. QML is currently using the quote unquote wet flock swab method, and the other providers, SNP, VCS, are mostly using the dry flock swab. We don't know of any quality differences between those two methods. It's really been a matter of new laboratories that were coming on board in response to this change. We're able to get accreditation quicker and validate their samples more quickly through the thin prep method. Thanks.
Thanks, Jenny. Another question, and perhaps this one would be a good one for both of you. I know that some of the feedback we had from last week's webinar was just to speak about self-collect, I guess, from a male GP perspective. And I was just wondering, Meg, if you've spoken to any male colleagues and perhaps if this is something that they're finding is particularly useful. And I guess, Jenny, to you, what has been some of the feedback from male practitioners?
Yeah, so preparing for this webinar, I certainly spoke to the male GPs in my practice about what this change had meant for them in their practice, and they were, unanimously positive about it. They have found that it's easier to discuss. They can bring it up opportunistically in the consultations, and they can keep when they may have not been doing as much clinician collection of cervical screening, that they can confidently be offering it to people, and they've found that it's been a great change. So that's been their experience.
I guess I'd just add to that and saying that we had a pilot study this last year. Brisbane North PHN was one of the partners in that. and did a number of one-on-one visits with GPs and talking to them about self-collection. And, you know, anecdotally in those visits, we found that most male GPs ahead of that pilot said that they had very little to do with cervical screening, that most of the time they were referring to a female GP within their practice or elsewhere to do a cervical screening test. And but they were interested in and enthusiastic about self-collection in the first instance, and then through this pilot started offering it, and they felt really good about that, being able to be part of the program. I think it's important, as Meg would probably say, to, if you know a male GP still feels uncomfortable with doing that that exam or a speculum exam, that there is somebody that you will be referring to if you have somebody with a self-collect that ends up needing either, you know, a colposcopy or an LBC. Yeah, so I think that, you know, the time has come for self-collect and for male GPs to be involved. And I know that, you know, we do have one of the practices that I went to had 9 male GPs and had lost their last female GP. It would be a real shame, you know, for women to not be able to access a cervical screening test within that practice. Thanks.
Thank you to both of you for your answers there. We've had another question just about, if you are self-logging this whole activity as CPD, what do you think the points value and distribution? And to answer that question, we have been having some meetings in advance of this project and other ones with RACGP just around that and some of the changes to the CPD hours. And the answer to that is it depends on the parts of the project that you implement. So there is very good reason why you could accumulate your 5 hours of measuring outcomes and your 5 hours of reviewing performance with doing a project like this, depending on the activities that you are doing. So for instance, if you are participating in this webinar, if you are then having meetings with your practice, if you are particularly for the reviewing performance and measuring outcomes, you want to be tracking what your cervical screening offers are and what the outcomes of that are. And that's where some of the resources that I was showing can come in to really get some of those points. So it is self-reported and it is based on some of the activities that you do. And there are some guidelines around that that help support that. So we can certainly assist with that if anybody is interested in doing more work around that to get those CPD hours. And I'd encourage you to just contact us at Practice Support and we can help support you through that. Now we're just getting some more questions here, so just give me a moment. Okay, so we've just had a question here. And I'm wondering if Meg, you might be able to answer this one for the results of, oh, it looks like we've just lost it. There is a question here. Is there more that nurses can do to support doctors and patients? Meg, is that something that you can provide any more thoughts on?
Yes, so I just wondered, did you want me to also answer the question about verbally, the question about results?
Yes, that's the one that I lost track of.
There's a question. Yeah, there's a question in the chat about, is it the practice responsibility or the cervical cancer screening register responsibility for results? So even when patients are doing a self-collection, you are still referring them for the test. So it is the referring GP's responsibility to inform the patients of the results, regardless of the method of collection of that test. And it's really up to the individual practitioner how they like to do that, whether they like to do that by text or by phone or face to face. And also it's up to the individual practitioner and their practice about what billing they may use for that. But you absolutely have to let patients know the result and to let them know when their next test is due. And then the second question about how might nurses get involved. I mean, I think it's also depends how nurses are involved in the practice in general. So if nurses are involved in meeting with patients, when they're doing anything in the treatment room, if they're doing treatment for other things, if they're doing care plans, if they're doing immunizations, that there's always an opportunity to discuss this and answer questions. So I think it's great if nurses are aware of cervical screening and the different options for how it can be done, and definitely can be very helpful in explaining to patients how to actually do it by using those visual aids, and to if a patient does need a chaperone, then to be kindly being the chaperone.
Thank you very much, Meg, for that answer. And thanks everybody for their questions and for coming tonight to the webinar. If you would please just stick around for a moment just to answer our evaluation. Once again, we'd really appreciate it, as it helps to make these events more meaningful and more useful for you. So I hope that this provided you with some new information perhaps, and have a good evening. Thanks very much, everyone.
Thank you.